Let me welcome you all on behalf of the Center for Global Health Histories of the University of York to the seminar on the history of malaria elimination in Sri Lanka. I'm Dr. Suranga Dolamulla, Senior Research Fellow, University of York, UK, and a specialist in medical administration, Ministry of Health, Sri Lanka. This is the 150th seminar. Therefore, this seminar marks a great milestone of the Global Health Histories Seminar Series, for which the WHO Euro has been a partner organization. And those seminars are generously funded by the Wellcome Trust, a global education charity based in London, UK. Sri Lanka, then Ceylon, started to use bed's net before the recognition of the parasite, then launched an organized malaria control program in early 20th century. Even though facing a devastating malaria epidemic in late 1930s, which had a death toll over 80,000, Sri Lanka was able to reach near elimination in the 1960s due to an effective use of DDT-led malaria control measures. However, it took another half a century to obtain malaria-free certificate from the WHO and eliminate malaria from Sri Lanka. Today, we have 5 eminent speakers from Sri Lanka who worked or working currently on malaria control activities in Sri Lanka or other countries. Professor Rajitha Wickramasinghe is a public health specialist and former Dean Faculty of Medicine, University of Kelaniya, Sri Lanka, and Gauri L. Galatpatti is a team leader, malaria and neglected tropical disease, WHO Malaria Philippines, and Ravindra Jainet, the former regional malaria officer, Anuradhapura District, Sri Lanka. Then closing remarks will be delivered by Dr. Lakshmi Somatunga, Additional Secretary Public Health, Minister of Health, Sri Lanka, and Dr. Prasad Ranavira, Director, Anti-Malaria Campaign. The lineup of this event will be presentation from 3 panelists, followed by Q&A session and closing remarks. Then let me introduce the first speaker, Professor Rajitha Wickramasinghe. Dr. Rajitha Wickramasinghe is a professor of public health and former dean of Faculty of Medicine of University of Kelaniya, Sri Lanka. He's an epidemiologist and biostatistician, having over 25 years experience in malaria control, elimination, and prevention of re-establishment and working with the National Malaria Control Program in Sri Lanka. He has a wide experience in malaria control and elimination in the Southeast Asia region, working with the National Malaria Control Program in Nepal, Myanmar, Bangladesh, and Timor and Laos. So, Professor Rajitha Wickramasinghe, it's over to you.
Thank you, Suranga. A very good morning, afternoon, or evening, depending on the time of the day. And first of all, I would like to thank the organizers for inviting me to be part of this very significant seminar series organized by the University of York. So I'll share my screen. Right, so I would talk on malaria control to elimination in Sri Lanka, but in the first part of my presentation, I will limit it to the period before the establishment of the anti-malaria campaign in 1911. So that was the first establishment of a formal control program in Sri Lanka. As you know, there have been many things in ancient texts written about malaria. For example, the Babylonian texts written in the cuneiform text and in on clay tablets have attributed malaria to the Babylonian god of destruction and pestilence called Nagleri, who was pictured as a double-winged mosquito-like insect. So even in those days, malaria was present. The Chinese, the canon of medicine on I Ching, which was written about 4,700 years ago, also has important references to diseases like malaria. Similarly, in the Sumerian and the Egyptian texts also, which are about 3,500 to 4,000 years old, have references to malaria. Likewise, in North India, in the Indus Valley, there are also Vedic and Brahmanic text scriptures which refer to malaria or diseases mimicking malaria. And then around 500 BC, even in Greek writings, we had Hippocrates, the father of modern medicine, and probably the first malariologist who described the various malarial diseases of man around 400 BC. Then the Romans also coined the word malaria, which refers to bad air, and they believed that the storms around them were emanating these toxic fumes that was giving rise to these fever pestilences. Now, in this part of the world, we had a traditional system of medicine known as Ayurveda. And even in those texts, like the Karaka Samhita and the Susrut Samhita, about 300 BC and 100 BC, describes the symptoms and Ayurvedic treatment of malaria. In fact, the Karaka Samhita classifies the fevers into 5 different categories, and these include continuous fevers and intermittent fevers. And then the Sasruta Samhita even associated fevers with bites of insects. So even during those times, they had some idea that malaria may be transmitted by insects. Now, this is one of the oldest maps of Sri Lanka. And of course, it's similar to what we have now, but with the present map is much more accurate compared to this. And there have been questions whether our ancient kingdoms, whether they fell due to malaria. And those days, most of the population were resident in this area of the country or the North Central province. And this was supposed to be a highly developed system then, and where agriculture was the main livelihood. So these are some pictures of the areas that were considered to be devastated by malaria and where kingdoms fell. And here we have some pictures of Polonnaruwa and Anuradhapura, ancient kingdoms, which were situated in the North Central province. And they believed that malaria ravaged in these areas due to disruption of the excellent hydraulic river systems that we had, irrigation systems, and these were destroyed mainly with South Indian invasions and other wars that took place during this time. There is also another theory, and that is that the fall of ancient hydraulic civilization in Sri Lanka in the 13th century was also due to a sudden natural cataclysmic change in the river course of our longest river in the country, the Mahaveli Ganga. So this is also another hypothesis, and it is believed that because of this change in the river course again, there was massive epidemics of malaria, which finally resulted in the downfall of these ancient kingdoms. Then later on, there were also writings on Ceylon by famous people, and one such person was Robert Knox. He was English seaman who mast of his boat broke, and he was then drifted ashore to Sri Lanka. And he relates a book called An Historical Relation of the Island Ceylon. And in that book, now this book was written in 1658, and in that book, there are references of fever pestilences in the country, which had depopulated many large areas in different parts of the country. So there really were evidence to show that malaria was prevalent in Sri Lanka for a very long time. Now, quickly, let's look at how our villagers were trying to control malaria. Now, this is a picture of what we call a Purana Gamma, or this is an ancient village. And the structure of this village has some unique characteristics. So just have a look where you have the lake right in the middle, and around it only we have the people living around it. So I'll give you a schematic diagram of this structure. So here we have the lake or the tank bed, and then we have the bund. And then as agriculture was the main livelihood that in those times and still is, we had the paddy fields or the rice fields just by the lake. Then we had shrubland here, and then also there was a tree belt here and another tree belt here, right? Acting as wind belts. And then the hamlet where the people lived was located here. Now, this area you see here where rain-fed Chaina farms, so this was all jungle area, because Chaina means slash and burn type of agriculture. And in these jungle areas, we had these rain-fed Chaina farms. And here in the middle, there were the grasslands for cattle to graze on. Now, in this, the hamlet was separated by a buffer zone from the paddy fields. Now, look at the way the hamlet was situated. There was a buffer zone between the paddy field and the hamlet, which prevented people, or which prevented mosquitoes that may have bred here to reach this hamlet. Likewise, between the forest and the hamlet, there was also another buffer zone in terms of grasslands where the cattle used to graze on, and also prevented the mosquitoes coming from the forest and biting people in the hamlet. Instead, they preferred to feed on the cattle and other animals that were grazing on in this farm, in the grass fields. So this way, they had a buffer zone to prevent mosquitoes reaching human settlements, and where animals to some extent were used as bait to prevent mosquitoes attacking the people in the hamlet. So this had a unique structure, and there are reports to say that this may have been one way of malaria control during this period. And as you know, the principal vector of malaria in Sri Lanka, Anopheles species, is an anthropophilic mosquito, and it also takes blood meals from other animals such as cattle. So this was a natural way of prevention or control. Then in the 1940s, during colonial rule, and the British, this has been recorded in a book by Sir James Emerson Tennant. And here there is reference to using mosquito nets in some form to prevent mosquito bites, actually using bed nets. So if I read the passage, I quote, "In traversing districts suspected of malaria, experience has dictated certain precautions which with ordinary prudence and firmness serve to neutralize the risk, retiring punctually at sunset, generous diet, moderate stimulants, and the daily use of quinine both before and after exposure. These and the precautions at whatever sacrifice of comfort to sleep under mosquito curtains have been proved in long journeys to be valuable prophylaxis against fever and the pestilence of the jungle." Now this, mind you, this was written in 1840, and if you look at the history of malaria, the malaria parasite was discovered by the French army doctor Alphonse Laveran in 1880, and the mode of transmission was described by Sir Ronald Ross in 1897. So there are references to malaria control even before the detection of the parasite or its mode of transmission. I will stop here for the moment and come back at the end of the presentations to make a few comments. Thank you, Surang.